Okay, thank you, Thomas, for your presentation and your research into Ibogaine therapy. Given that there are now small observational studies showing the benefit of Ibogaine therapy, as well as numerous clinics that offer this treatment, why don't you think we have more studies using Ibogaine?
Well, it's very difficult to get approval for studying Ibogaine in most countries, including the US. Here, where Ibogaine is a Schedule 1 substance, which is the most restrictive schedule. So getting permission to do research is very difficult. And in my opinion, the main reason why it is on Schedule 1 is because it's psychoactive, and it was simply swept up in the war on drugs back in the late 60s and was made illegal, and then it was put on Schedule 1. So because it's psychoactive, and it was simply grouped along with these other psychoactive things like LSD and psilocybin, and made it very difficult to do work with.
And the research on psychedelics are now sort of having a renaissance, but why don't we see Ibogaine like joining?
That's an interesting question, and I've heard Ibogaine sort of referred to as the sort of the lonely stepchild of the psychedelics world. It has gotten this reputation, and part because of as I'm sure you're aware, there are some risks associated with Ibogaine treatment, and many of those risks are related to the fact that people are coming into treatment in very poor physical health, and they're usually with years of very heavy opioid use, and there aren't any standardized practices at these clinics. And so but the fact is that there have been deaths documented, as my colleague Ken Alper says, in close temporal proximity to Ibogaine treatment. And it's gotten this reputation as a dangerous sort of drug, whereas the other psychedelics like LSD and psilocybin do not have that reputation as being dangerous.
Yeah, I understand. Well, Ibogaine has a very complex pharmacology affecting many neurotransmitter systems at the same time. It also has a unique psychoactive effect in that it seems to simulate or stimulate a sort of retrospective viewing of previous important or perhaps traumatic experiences. Can you tell us what you think is the important factor in how Ibogaine might help people with addiction?
Yes. So I referred to other psychedelics like LSD and psilocybin. Ibogaine is technically it's not one of those sort of classic hallucinogens or psychedelics, although it does give people insight into their psyche, and it does give people psychospiritual insights, but it's more properly called an oniric drug. That is, it's kind of a dream producing. It produces that kind of state of consciousness like a waking dream, and as you mentioned, it has this common feature, this typical feature where people have a kind of recall of past events in their lives. Sometimes they'll have conversations with people, whether they're famous figures or people from their families. They might relive conversations that have actually happened. They might even recall conversations that they had not even thought about since they were children, things like that. My sense of how this works psychologically, I mean, I'm not a psychologist nor a psychiatrist, but the insights that people get oftentimes have to do with things like they realize how much damage they've caused in their relationships, and they have very, very deep regrets about the things that they've done, and the things that they've done in the name of acquiring more of the substance that they're addicted to. They also, at the same time, can have this sort of reconciliation and understanding of where their trauma that is coming from, what were the causes of their addiction, and why they are in this cycle of behavior that is harmful for them. And in some cases, you see people who are able to reconcile these traumatic events. I want to just give one example, and that is that there was a young man who was treated at one of the clinics in Baja California, Mexico. He was, I think, 22 when I met him, and he was receiving treatment, but he had been in a very abusive family situation where his father, when this young man was 15 years old, his father actually injected him with heroin. His mother left the family. His father was extremely abusive, and this young man ended up living on the streets in San Francisco for several years. And he said that when he went into treatment, he hated his father. He wasn't in touch with his mother at all. He was estranged. And during the Ibogaine experience, he had this insight, this revelation that despite all the horrible things that his parents had done, and that his experiences really made him who he was, and he was able to forgive his parents for everything. And the power of that he could reconcile that, and then he got in touch with his mother after that, and they reestablished a relationship. That's a very powerful thing to be able to do, to reestablish those kinds of relationships, and it's a truly transformational experience.
Yeah, really interesting. I also know that you and others, you did a study exploring the subjective experiences of 44 participants from these observational studies that you mentioned in your talk.
Yes.
In this study, I know that you said you found that half of the subjects had some kind of complete mystical experience. You used the states of consciousness questionnaire. And can you tell us more about this study, and how important do you think the psychological experience is regarding the treatment effect?
Yeah. So that study, yes, we took some of the data from both of the studies. There was the Mexico-based study that I mentioned in my presentation, and the New Zealand-based study that my colleague Jeff Noller did. And we had 44 total people from the two studies, and we'd asked them to write about their experiences after their treatment. And we had also, as you mentioned, given them the States of Consciousness questionnaire. And so we had that measure showing that some of them had full-on mystical experiences, and there was quite a variability in the intensity of the experiences that different people had. But many of them had very profound experiences. And the narratives that we obtained from what these people wrote about their experiences, and also from the interviews that we had with them over the 12-month period after their treatment, sometimes they would tell us about other things that they hadn't told us about earlier, and we kept records of all these things. And for the people who stayed in the study and who actually followed through for those 12 months, a disproportionate number of those people had those very powerful experiences. And my sense is that the powerful experience gave them the sense that something had happened, that something had worked with that. And there are some people who had the Ibogaine treatment who didn't have much of a psycho-spiritual experience at all, who didn't remember anything from it. It was kind of a jumble of confusing imagery, that sort of thing. And those people were much more likely to drop out of the study. And individuals told me, over and over again, that they found the experience that they had to be quite profound and transformational. So it wasn't just that they had these, states of consciousness questionnaire scores that were high. They attributed a great deal to those experiences. So yeah, so that helped.
It's like a correlation between what type of experiences they had and the treatment effect.
We weren't able to demonstrate that in part because of the small number of people in the study and the small number of people who actually completed those kinds of questionnaires, the narratives, and who continued to follow up through the study. Because so many people dropped out of the study, what really stuck out to me when I looked at the data was that the people, as I mentioned, who stayed in the study were those who had the powerful experiences. And in our statistical analysis, and in the original paper that Ken Alper and I did together, to have the greatest statistical rigor, we assumed that anyone who dropped out of the study had reverted back to their baseline. That is, they were doing as badly as they did before treatment, so the treatment didn't work. So if you factor that in, and you look at the, you then look at the states of consciousness questionnaire results versus the fact that people stayed in the study, and you factor in that people who dropped out were doing badly, that actually shows that the people who had the intense experiences did better on follow-up for the 12-month period. So it's a little bit of sort of a almost like a shell game, but that's it was so pronounced that the people who stayed in the study were the ones who had those powerful experiences, that I think there's something to it.
Yeah. And I think it's important to remember side effects when considering these types of therapies. And after interviewing so many subjects, do you think Ibogaine can be psychologically harmful for some individuals? And if so, what type of individuals do you think is at risk for these harmful effects?
Well, from my interviews, I would say I haven't seen that it can be harmful, and I haven't heard of people having harmful experiences, with one exception, and it was somebody who used to work with MAPS, who wasn't getting Ibogaine for treatment of addiction, but was using it for psychospiritual purposes. And that person was left alone in a room on a cold basement floor, and had a really Ibogaine can be a very, very difficult experience, even if you're not recovering from addiction. And if you're recovering from addiction, it can be very, very trying. So I would say that if someone is going in, I would say, if you are experiencing, if you're schizophrenic or experiencing severe mental illness, I would not advise going into Ibogaine treatment. However, if you are otherwise, mentally, and emotionally healthy, then the only real risk is to not have any follow-up, to not have the kind of care. I think that it's important to have at least someone in attendance while someone's doing Ibogaine. I certainly wouldn't recommend that anybody take Ibogaine or Iboga on their own and just do it on their own. But following up with people afterwards with good psychotherapy and with addiction recovery care is very important, to be able to, because people will have these difficult experiences. They might feel tremendous remorse over things that they've done, and feel like they've wasted their lives and things like that. And it's really important to have somebody to talk with about these experiences afterwards, and be able to integrate those experiences and make something valuable out of them.
All right. Thank you so much for your time, Thomas. Do you have any closing remarks you want to say aloud to the conference?
No, I don't think so. Just to thank you, Andreas, for having me speak at the conference, and I regret that I could not be there in person.
Yeah, likewise. Thank you.
You're quite welcome.